Mr. President,
Yes.
a health-related question on your health care plan. You've said you want to make direct payments to Americans, but these Obamacare subsidies are expiring now in a matter of just a few days. More than 20 million Americans are now bracing for their premiums to skyrocket. Are you going
Because
to
of
let this
Obama.
happen, or
Yeah,
will you
because-
intervene?
Yeah, they will skyrocket because it was never any good. I'd like to see the money that is going to the insurance companies by the hundreds of billions of dollars. You know, their stocks are up 1,400%, 1,800%, and 1,624%. Their stocks are up through the roof over a fairly short period of time because they're getting vast amounts of money. I want that money to go to the people directly and let the people buy their own health care. And they'll get much better health care than they get with the Unaffordable Care Act, as it's known by a lot of people. It is virtually unaffordable for people. It's a bad thing. We can have a great thing. Let the money go directly to the people and let them buy their own health care.
But this is an urgent problem, Mr. President. Is there anything you can do now, Mr. President?
Can I answer, Mr.
This
President?
is going to be right now, as far as I'm concerned. Go ahead.
We just got data today. We have federal exchanges where people come shopping for the ACA. And the president hasn't heard this yet, but we've talked to the team. The percentage change from last year was down 2.7 to 2.8%. Not the massive numbers that have been predicted. And there's many possible reasons for this, but right now Americans are signing up for these programs despite all the things that have been going on. 2.8% is a tiny fraction of what many had claimed would happen, and I think it speaks to the fact the American people appreciate these ACA plans are already subsidized over 80%. So it's a good deal, even if you don't get the extra 15, 20%.
It's a great solution to much better health care at a much lower cost. Yeah, please.
But do you want Congress to extend these ACA subsidies?
Well, I'd like not to be able to do it. I'd like to get right into this, and I'd ask Oz this question in particular, but I'd like to see us get right into this. I don't know why we have to extend. This could be done rapidly if the Democrats would come along. We have a problem. The insurance companies own the Democrat Party. They own it. And the Democrats having a hard time. They give a lot of money to the Democrats. Very little money to Republicans, by the way. A lot of money to Democrats. And they're going to have to decide, do they want to do the right thing or do they want to be beholden to the insurance companies? They're making a fortune. I want the money to go to the people. Go ahead, Oz. How would you say that?
I agree with the president. We have some ideas out there. Congress is working through some concepts. But I just want to emphasize that the ACAs are not imploding based on the data we just received from the federal marketplace.
This can go very quickly, actually. Yes, please.
Mr. President, can I ask you, clarify something for me on the Federal Reserve? How many people are you interviewing for the Fed chairman, and what did you think of Chris Waller?
I think he's great. I mean, he's been a man who's been there a long time, somebody that I was very involved with in the sense of his career, and he's a fantastic man. I met him yesterday, again.
So how many people are you looking at?
We're talking to 3 or 4. I think every one of them would be a good choice, honestly.
Michelle Bowman?
We'll be making a decision pretty
Is
quick.
Michelle Bowman on that list too? Are you going to interview her?
She's fantastic. She's a fantastic person.